Our subject today is to discuss peptic ulceration in relation to Ramadan. Our patients could fast Ramadan or not when they have a peptic ulceration. Peptic ulceration means wounds in the stomach in relation to acidity of the stomach. And peptic ulceration could occur in the stomach itself or in the duodenum, which is the part following the stomach immediately of the small intestine. The causes of gastric ulceration is completely different from that causing duodenal ulceration. The causes of gastric ulceration usually problems in relation to the mucosa of the stomach itself. And one of the commonest cause of this gastric ulceration is one of the bad habit among us, which is smoking and taking a cup of coffee, and usually adding when we have a headache. This cocktail is ulcerogenic to the gastric mucosa. The second common cause of gastric ulceration is the use or abuse of anti-rheumatic drugs. The non-steroidal anti-inflammatory drugs causing bad effect on the mucosa of the stomach. And we advise patients with rheumatic pains to take these drugs with something protecting the mucosa of the stomach. Another cause causing gastric ulceration is infection by Helicobacter pylori bacteria, which is proven nowadays to be one of the factors causing gastric ulceration. Otherwise, duodenal ulceration occurs due to increase in the acidity of the stomach. And the increase in the acidity of the stomach usually affecting people with high intellectual thinking function, like doctors, like ministers, like judges, like anyone using his mind all the time. This form of stress usually increasing the gastric acidity, causing ulceration of the duodenum. Also patients with increased acidity usually, so the patients with duodenal ulcer, usually such patients has such increased intellectual function of the brain. And so the cause of gastric ulceration and duodenal ulceration is different. What the symptomatology of patients with gastric or duodenal ulceration? Patient with gastric ulcer usually feels pain in the upper part of the abdomen, usually following meal immediately or after quarter of an hour after meal. And these patients, to relieve their pains, usually they put their finger in the mouth to induce vomiting to relieve pain. And usually these patients afraid to eat, so they lose weight. And vomiting is a feature of gastric ulceration. If we compare this symptomatology to duodenal ulcer, the patient with duodenal ulcer feels pain following a meal, but this pain usually comes 2 to 3 hours after meal. And this is a hunger pain. And the patient, to relieve his pain, usually eat more. And this pain comes periodically. In some weeks, patients did not take any treatment and he feels better. And some weeks, he feels pain and start to take medications. Patients with duodenal ulcer usually awaken at night 1 or 2 hours after deep sleep because of pain in the retrosternal area and the upper part of the stomach, pain in the chest and the upper part of the stomach. And he go and drink some milk and a piece of biscuit to relieve his pain. But patients with duodenal ulcer rarely vomits. And if he vomits, this means that this patient enter in a complication of peptic or duodenal ulceration, where the pylorus or the duodenal area becomes stenosed and he vomits later. As regard the diagnosis of these cases, usually we are dependent mainly on the upper gastrointestinal tract endoscopy. This is a fiber optic endoscope introduced through the mouth. It is easy, and in the minority of cases, these patients needs just a minor dose of hypnotic to introduce the endoscope, and the endoscope could visualize the inner part of the stomach, the lower end of the esophagus, and the duodenum, and they can diagnose the presence of an ulcer either in the stomach or in the duodenum. And the importance of the endoscope at this area is very important, because gastric ulcer, when it is located away from the lesser curve and or its size increases more than 2 centimeters, it usually arises the possibility of malignancy. And here it is very important that endoscopy is not only diagnostic for the lesion, but diagnostic for the pathology. We take a biopsy and we analyze it, because such a biopsy will, and its result will assess later for the treatment of these cases. So it is very important to do endoscopy for every patient complaining of pain in the upper abdomen suspected to be a peptic ulceration. When we are examining these cases, just we find a tenderness in the epigastric region. This is enough to diagnose the possibility of gastric problem. And in the treatment of these cases, usually we treat gastric ulcer by giving the patients drugs that coat the inner wall of the stomach. This will protect the stomach. But when we are going to give patients with duodenal ulcer treatment, usually treatment by drugs that decrease the gastric acidity by what is called H2 receptor antagonist or proton pump inhibitor. As regard to Ramadan and fasting, patients with gastric ulcer, we advise them not to fast Ramadan, because they feel pain and they need a frequent drugs to coat the stomach, and they lose weight. So when the ulcer is active and the pain is severe and vomiting is repeated, it is not wise to fast Ramadan. But patients with duodenal ulcer, when there is a hunger pain, in the past, when drugs are not available to decrease the gastric HCl or gastric acidity, in the past we advise them not to fast Ramadan. But now, because of the presence of good drugs can be given at Al-Fajr, before Al-Fajr, we can give them a proton pump inhibitor to decrease gastric acidity all over becoming 12 hours, and so we advise them it is a must to fast Ramadan under these drugs. As regard the treatment for gastric ulcer, when there is a failure of medical treatment or there is a suspicion of ulcer, surgery is advised. And when for duodenal ulcer, in the majority of cases, they heal by medical treatment, and rarely we resort to surgery if complication arise or medical treatment fail. Thank you.